Hi, I'm Dr. Juhi, and I work at Self Care by Suman as a doctor and a clinical nutritionist. Today, we're going to discuss about how over-exercising can actually have a negative impact on your heart health. So, yes, of course, we know that regular exercise or regular activity is something that's beneficial to you and has many health benefits. But there is a downside to over exercising, and it can have its own health risks. So let's jump into that. A recent study conducted in the US observed 3,200 people over 25 years and found out that people who were exceeding the recommended exercise guidelines of 150 minutes of moderate intense activity per week or 75 minutes of vigorous activity per week by 3 times, who were exceeding these guidelines by 3 times, had an increased risk of developing calcium deposition in all their arteries and increasing their risk of developing coronary heart disease in the long run. So this shows us that yes, over exercising can negatively impact your heart health. The researchers or scientists haven't been able to exactly pinpoint why or the pathophysiology of why this is happening. Additionally, a study in Denmark also showed us that they followed joggers and they found that people who were jogging for longer at a higher intensity had an increased risk of developing heart disease as compared to those who were regularly jogging but at a lesser intensity for a lesser period of time. So this again emphasizes on the fact that we need to realize that too much exercise is not going to be good for us. Now, how do we determine how much is good for us? First is we should try to stick within the guidelines, okay, which is 150 minutes of moderate intense activity per week. Now this can be divided into walks, jogs. So a brisk walk or a jog would be something counted as moderate intense activity, or whether it's swimming or cycling. So even though there are multiple studies that are throwing light on over-exercising having negative health impacts, there still needs to be a better understanding and more research that delves a little bit deeper into this, because there can be some uncertainties which haven't been addressed in the current research that there is. With that being said, we do know that too much exercise is not going to be good for us. So we need to be able to understand how much is too much and how much we should be doing. So let's break down the guidelines. The guidelines say 150 minutes of moderate intense activity, which include a brisk walk, jog, swimming, cycling, functional training, weight training. Vigorous activity should not be more than 75 minutes per week, which can be anywhere from HIIT to CrossFit to intense weight training where you're lifting heavier weights. And the second marker we can use to understand whether we are over-exercising is our target heart rate. Okay, so this is something that we need to set with either your doctor, nutritionist, or your exercise expert. This target heart rate is a heart rate that if you go below, you are not doing the adequate work, or your heart is not doing the adequate work to see the benefits. And if you go above it, you may be actually negatively impacting your heart health or general health. So this target heart rate is the way you can calculate it. We're going to put it in the caption below. However, please do confirm it with either your doctor, nutritionist, or exercise expert. This is something you can track via digital trackers, whether it's an Apple Watch, Fitbit, etc., while you are exercising. However, again, you need to note that these are digital trackers and they can be faulty or they can be inaccurate at certain times. Therefore, you need to use your own body cues as well, which is when you feel extremely breathless, or you're feeling uncomfortably breathless or uncomfortable at any point. That is when you need to know that you need to take a break from the exercise and not push yourself above a certain point. Take a break, take deeper breaths during that break, and lower the intensity and start it again if you have to. So what I would like to end with is emphasizing that yes, over-exercising can affect your heart health or your overall health negatively, but we need to still acknowledge that regular moderate intensity exercise within the guidelines is going to benefit you in multiple ways, whether it's your heart, your brain, your digestive system, or any of that. So, over exercising may not be good for you, under exercising or a sedentary lifestyle may not be good for you. You need to find that sweet spot or that little balance between the amount of exercise you do and the intensity with which you do it. Stay safe, and if you have any questions, please do drop it in the comments below.